Okay lang. Okay. Okay.
Okay.
Everybody's ready? How many?
Okay, so the class right now, we are expecting around 16.
One.
Two of them to have dropped from the official roster, and then one of them has a very important family emergency that I will not disclose due to personal reasons. So around 16 po.
Okay. Good afternoon, everybody. Okay.
Afternoon, sir.
Good afternoon, sir.
Good afternoon,
Afternoon, sir.
Thank you for the kind introduction, Patrick. So again, good afternoon. I am Dr. ROJoson. I was asked to give a lecture with this title. Okay, I'm sorry, I pressed on the wrong one. This is for the second part, no? Okay, sorry. Okay, let me. There. Okay. System thinking. Okay. Okay, I hope I get this right. Okay. So again, good afternoon. I am Dr. ROJoson. Okay. I was asked to give a lecture with this title, Systems Thinking in Healthcare Facilities for this particular class, HA202, with a time limit of 30 to 45 minutes. I hope I can finish it in 45 minutes. Okay. And with the following prescribed learning outcomes or objectives at the end of the session, understand how to run and manage a hospital effectively and efficiently by systematically using the systems approach or perspective and systems thinking. Number two, understand the importance of alignment and integration in managing a hospital and its departments. Number three, describe a department design and development framework, how to use and apply it, and be familiar with the basic requirements in it. And lastly, discuss the common challenges encountered in the governance of departments together with their suggested strategic solutions. So with these prescriptions given to me by the course director, I shall delimit my presentation on health facilities because the title is health facilities. Okay, so I shall delimit it to hospitals which focus on a department since we are in HA202. Okay, so rather than in the entire hospital. Thus, I will change my title then to System Thinking in Hospitals which focus on departments, so that I will be aligned with the learning outcomes or objectives. So let's start with the structure and basic functioning of the hospitals. All hospitals are made up of many different departments and services. We looked at the hospitals as a system, that is, a set of interrelated but separate parts working together or towards a common purpose. As hospital managers, we must know how to manage the hospitals effectively, efficiently, by making sure that all the various different departments and services, and there are many, are aligned and integrated in their governance and functioning. Systems perspective, systems approach, and system thinking are various terms that one will encounter in management discipline manuals and in the internet, and all are geared towards ensuring alignment, coordination, collaboration, and integration of the functioning of interrelated parts of a system. Suffice it to say that systems perspective or approach views the organization or the hospital and also the department of a hospital as a unified, purposeful system composed of interrelated parts. And this perspective or approach makes the manager sees the organization as a whole and as part of the larger external environment. Okay. So not piecemeal, just look at the hospital manager has to look at the hospital as a one whole organization. System thinking, on the other hand, is a holistic approach to analysis. Okay. So when I say system thinking, it implies some amount of analysis going on in the mind of the manager that focuses on the way that the system's constituent parts interrelate and how systems work over time and within the context of the larger systems. Put it another way, systems thinking is basically a way of helping a manager to view the systems from a broad perspective that includes seeing the overall structures, patterns, and cycles in the systems, rather than seeing only specific events in the system. This broad view can help the manager to quickly identify the real causes of issues in the organizations and not just where to work to address them. System perspective, approach, and thinking are management disciplines that are concerned with an understanding of the system by examining the linkages and interactions between the components that comprise the entirety of that defined systems. The bottom line of the system perspective, approach, and thinking is the recommendation for all managers to view and analyze in the hospital and departments holistically and comprehensively, and to always look at the interactions of parts to other parts and to the whole, and vice versa, with alignment and integration in mind as key results areas and key performance indicators. So what is alignment? Alignment, as defined by Baldrich's healthcare criteria for performance excellence, means a state of consistency among the plans, processes, information, resources, decisions on resources, workforce capability and capacity, actions, results, analysis. So everything in the system that supports the key organizational wide goal. Alignment means consistency between all hospitals and hospital goals. That's the first one. Then consistency also means, alignment also means consistency between the department plans and the department goals. And lastly, alignment means consistency between the department plans and the entire hospital, the goals of the hospital. So it also means quality of doing things towards the same direction. So that's to be aligned, all staff should be clear about the hospital's purpose, like the vision and mission, and policies and procedures, as well as those of the department, and make decisions in accordance with them. What is integration? That's the next question. Okay. Integration means the harmonization of plans, processes, information, resource decisions, workforce capability, and capacity, actions, results, and analysis to support the key organizational-wide goal. So alignment means consistency. Integration means harmonization. So this is also a definition coming from Baldrich's healthcare criteria for performance excellence. Integration means harmonization between and among all parts in the hospital and departments to produce a unified or common outcome or goal. It is said that effective integration goes beyond alignment. So it's not enough that you're aligned, you have to go beyond it. Okay, you have to integrate everything. And it is achieved when the individual components of a system operate as a fully interconnected unit, such as a harmonization of music by an orchestra. In effecting harmonization and integration, it is implied that there is coordination, or the other term for that is synchronization, collaboration, or cooperation of every parts. Okay? And these are very important. This slide illustrates the concept of alignment in number 3, okay, and integration in number 4. The ultimate target is an integrated approach in number 4. Okay. Number 1 illustrates the complete absence of uniform or consistent direction of the arrows. These arrows are represented by the processes. So all are in the different directions. So this is the phase in which the organization is just reacting to problems. Okay. Number 2 illustrates some amount of uniform, some common consistent directions of the processes or arrows. So this is an improvement of the first phase. So this is the phase of early systematic approach, which should be further developed into alignment and eventually integrated approach. As I said, the ultimate target is integration. As mentioned earlier, in effecting harmonization and integration, coordination or synchronization, collaboration or cooperation of the aligned parts are very important. So this slide shows the alignment on the left side. Then with coordination, collaboration of the different parts, integration is achieved. Okay. So these are the 2 major keys to performance excellence of hospital, achieving all these things: vision, mission, goals, directions, and projects. So back to systems thinking in hospital with focus on departments. As mentioned earlier, all hospitals are made up of so many different departments and services. The number varies from one hospital to another. The minimum number will be 1 imposed by the Department of Health licensing body. So it is the current definition of the different levels of hospital, types of hospitals are level 1, the basic departments and services. Level 2, with medical specialties, but without training departments. But there are more departments than level 1. In level 3, there are medical specialties and that have medical training, that a training program, okay, like the fellowship program, residency program. And thus, there are more departments and services than level 2 and level 1. Examples of the hospital departments and services. Under the first category, medical services departments such as departments of emergency medicine, outpatient department, and inpatient department. Diagnostic department is another category, okay, which includes the laboratory medicine, radiology, and nuclear medicine. Treatment departments, the third category. So examples of departments under this category are the operating room complex, OBGYN complex, rehab medicine department, the different medical specialties like internal medicine, pediatric surgery, etc. And then another big department here, treatment department, is the nursing department and dietary department. Medical support department is the fourth category. So you have the examples are facility management department, housekeeping department, security services, billing and cashier department. Another one will be the administrative support departments. So you have the example will be the quality and patient safety department. Okay, not all hospitals have this, but at the current time, there are a lot of hospitals creating quality departments. Okay. Materials management department, human resource development department, business development department, finance and accounting department. Other departments and services can be created by the hospital owners, okay, on the basis of needs as deemed by the administration. Thus, roughly a hospital can have a minimum of 25 departments and services. The number could be more, probably, or it can go up to 50 or even more. Again, this slide illustrates the importance of alignment, coordination, collaboration, integration of all the departments and services to effectively and efficiently achieve the performance excellence of a hospital. Okay. Alignment, integration, achieving the objectives, and then you end up, the impact will be a performance excellence for the hospital. Let's now focus on our discussions on the departments. Just as the hospital is made up of different interrelated parts in terms of departments and services, to facilitate achievement of its corporate goals, meaning the whole hospital-wide goal, each department and service is also made up of different interrelated parts to facilitate achievement of its authorized functions and services, meaning that of the department. And each department and service is also considered as a system. Just like the hospital is considered as a system, the department is also considered as a system. The hospital can be called the super system, and the departments and services within the hospital can be called the subsystem. Each department and service must also utilize systems perspective, approach, and thinking in the management as is being recommended for the entire hospital. That is, understanding the system by examining the linkages and interactions between the components within the department that comprise the entirety of that department. Viewing and analyzing situations in the department holistically, comprehensively, and to always look at interaction and parts of other parts and to the whole and vice versa, with alignment integration as the key results areas and key performance indicators. So this must also be done for the department. And not to say there must be alignment, coordination, collaboration, and integration of its department and service with the entire hospital, and I have to add with the other departments and services, with the interfacing departments and services. This slide illustrates hospital and departments as systems with interrelated parts, with the hospital being the super system, with the various departments as the subsystem, and the interfacing departments as co-systems. So you can look at it as super system for the entire hospital, the department, subsystem, the interfacing departments will be the co-systems. Each department, example, Department 1, is also a system by itself with interrelated parts. So when planning and doing problem solving, all managers should have a perspective and analytic thinking that look at parts of the department simultaneously at the whole hospital and vice versa. So the approach should be holistic and comprehensive and systematic, using the input, throughput, and output processes that consider the external and internal environment. So the key result areas of the system's perspective and thinking should be alignment and integration of all the subsystems or parts towards achievements of the department vision, mission, goals, and objectives, and eventually the hospitals. This is initially the department's vision, mission, goal, and eventually the entire hospital's vision, mission, goals, and objectives. This slide shows the essential and basic components of a department which must be present to facilitate accomplishment of its authorized functions and services and achievement of its goals. So there are about so many boxes, which represent the different components. So you have leadership, authorized functions, authorized services, the goals, architectural design, physical structure, DOH licensing requirements, policies, procedures, risk management, human resource management, equipment, material, program, data, document, records program, business development program, budget program, IT-enabled program system, regular performance, evaluation, and continual improvement. So all of these components must be present, aligned and integrated with each other. That's why there are arrows that go back and forth through its boxes. In order to achieve performance excellence for the department. So on the extreme left of the slides, one sees the need for alignment and integration with the entire hospital, as well as other departments in the hospital, the interfacing units. This slide also illustrates the super system, which is the entire hospital, the subsystem, which is a particular department, and the cost system, which is the interfacing department. The arrows indicate the need for alignment and integration of all parts of the systems, the department, with the super system, the hospital, and the cost system, the interfacing department. At this point, I'd like to disclose that this department design and development framework or administrative design and development program was developed by yours truly in 2010 to facilitate learning, planning, and administration. I think this is still up to the present time. And this department design and development framework is applicable to all kinds of departments and services in the hospitals, such as emergency room, surgery department, operating room, housekeeping department, dietary department, etc. To fully develop this framework, there must be a manual that contains the description, elements, and management systems of each box, and the so-called design and development blueprint. And after the design and development blueprint has been done, there must be evidence of implementation and evaluation of the results of the implementation. I shall now discuss the hospital department design and development framework, how to use it, how to apply it, and be familiar with the basic requirements in it. On the extreme left of the framework, there are 4 boxes that refer to hospital and interfacing departments. So whatever be the department, the administrative design and development framework should be aligned and integrated with the whole hospital concept, design, governance policies and procedures, operations policies and procedures, as well as the interfacing units, operations, policies, and procedures. In other words, there must be systems perspective or systems thinking. As to this box, leadership, so whatever be the department, there must be a competent head with at least the following competencies: unit technical requirements or competency on the specialty of the department, hospital teamship, managership, and leadership. There must be at least a job description or job descriptions, job specifications, and performance evaluation systems of the leaders and managers. Now, as to the second box here within the main framework proper, you have the functions. There must be a document stating the authorized functions of the unit. It must be complete and clear with general and specific functions, and it must be authorized by a higher office. Service, There must be a document stating authorized services of the unit. When you say the services offered here and the functions stated, okay, authorized functions granted by the higher up must be congruent with each other. Goals. Let's now go to the throughput, the output. Okay. Initially, I was talking about the input. Okay. Later on, I will talk about the throughput. Then here is the output, the goals. So there must be a document stating the ultimate goals, which must be aligned and integrated with the goals of the hospital. Okay. The department's goals should be aligned with the hospital's goal. The basic and essential goals are performance excellence, client engagement, quality and safe healthcare services, cost-efficient and value-based services, and maximal utilization of services. And all these goals should eventually be contributing to financial sustainability, viability, and sustainability. This slide shows the basic processes of management in the department design and development framework. So I said the input here, leadership, functions, and authorized services, the output, and then the throughput. Okay. Now let's go to the throughput. DOH licensing and structural requirements. This means the compliance to DOH, Department of Health, guidelines in the planning and design of hospital and other health facilities. There's a manual on this. Safe hospital initiatives, which include the structural and non-structural and functional indicators, building code, fire code, local government requirements, etc. Physical structure. This refers to the geographical space or service in the hospital to construct the department or service to receive patients as well as physicians. Okay. So these are the clients of the hospital, patients, and as well as physicians, requesting for services and to house the staff who will perform the functions of the department. The service requirements as dictated by the authorized function is the first determinant of the physical structure of a department. The other determinants for the physical structure are the following: the statutory and regulatory requirements, DOH licensing and requirements, okay. And then you have the part of them will be the Safe Hospital Initiative, okay. Then the building code, fire code, local governments requirements, specialty requirements, particularly those with training programs and research program, human resource program, equipment material program, data, document, and records program, budget program, risk management program, business development program, quality standards, community expectations. If in terms of efficiency is another determinant for the physical structure, the caseload, number of patients usually being seen in a month, in a year, and then, of course, the owner's wish or wants. So these are the determinants for the physical structure. As to the architectural design, engineering, construction, this will be dictated by the DOH licensing and structural requirements and the physical structure of the physical structure requirements. Human resource program, there must be a document showing the job descriptions, job specifications, performance evaluation system of the human resource for the staff in the department, and there must be documentation of adequacy and competency of the staff. Equipment and material program, there must be a document showing adequacy of equipment and material needed to facilitate an effective and efficient functioning of the department in consideration of the key functions and services of the unit, statutory requirements, other objectives like business development, risk management, IT-enabled system. Data document records program. Again, there must be a document that's showing adequacy of the data, documents, records needed to facilitate effective, efficient functioning of the departments. Business development program, document showing the presence of a structured and comprehensive program that will develop the business of the unit to make it viable and sustainable. Budget program, document showing that a budget that project the future income and expenses of the unit, and the budget is being used as a guide for day-to-day performance and financial evaluation at planned intervals. In the risk management program, there must be a document showing this kind of a program, which is a plan and systematic process or program to reduce or eliminate the possibility or probability of the risk that usually results in injuries, losses, and legal suits. So it may also include risks with potential positive effect, like those that can improve the business and client engagement. IT-enabled system, a document showing the use of IT to promote efficiency in the performance of functions and accomplishment of services, and to manage the information of the unit, such as getting, storing, protecting, processing, transmitting as necessary, and later retrieving as needed. And also to create an interconnection with other units in the hospital for timely communication, coordination, and collaboration in accomplishment of services of the unit, and also to communicate with the patient and physician clients, both in and out of the hospital. As to the box that contains the policies, procedures, clinical practice guidelines, and clinical pathways, this must be all documented, and this can serve as a guide to provide order, to promote standardization, and to facilitate communication, to promote effectiveness, efficiency, and to provide a guide to present and future staff, among other things. So the policies and procedures, clinical practice guidelines, and clinical pathways must be aligned with the policies and procedures of the entire hospital. They should be reviewed and revised periodically and as frequently as needed. Clinical practice guidelines and clinical pathways are akin to policies and procedures, but focus on patient management. The clinical practice guidelines is defined as follows: systematically developed statements built on synthesis of evidences, which provide formal recommendations about appropriate and necessary care intended to assist practitioners and patients to make decisions about appropriate health care for specific clinical circumstances. So these are just recommendations, guidelines, formal recommendations. Clinical pathways is somehow different. So it's more of an interdisciplinary plan of care or action that outlines the optimal sequencing and timing of intervention and expected outcomes for patients with a particular diagnosis, procedures, or symptoms. The other box here will be the regular performance evaluation and continual improvement program. So there must be a document that shows a program to appraise the extent of accomplishment of the department in its authorized functions and business plans at planned intervals, such as quarterly, biannually, or annual, and also to determine the areas of improvement and to act on them. So let's now go back. Let's now go to the okay, this is the last learning objective. Common challenges encountered in the governance of departments together with their suggested strategic solution. So the challenges can be in at least 5 categories: man, system and method, machine and equipment, money and other resources, and trends in hospital industry, healthcare, and medical sciences. Under demand categories are the consultants, okay, if there are residents, okay, residents, colleagues in other departments, chief of hospitals and bosses and other bosses, and of course the subordinates. Okay. So the common problems being encountered here among the people here would be the competencies, the quantity, alignment, coordination, collaboration, and integration of all the actions of these people. And then, of course, the personality of this group of people. Suggested strategies consist of leadership and managership skills. So managing your boss, if you have problem with your boss, you have challenges with your boss, you just have to manage your boss. Okay. So in terms of managing his personality, okay, look at his personality and then adjust accordingly, okay, to his or his mindset or mood, okay, for the moment, okay. And then, of course, the use of to get collaboration from each other, okay. So you use multi-sectoral, multi-professional committee membership to engage everybody into alignment, coordination, collaboration, and integration. The second problem here is the common problem will be the system and methods. Common problems are usually lack of systematization, lack of structured way of doing things, and then lack of standardized procedures. Suggested strategy, we can use the DOH licensure requirements as a guide. It's very detailed. Use the quality standards that are being published. You have the PhilHealth Bench Book, and then for the international quality standards, you have the Joint Commission International and the Accreditation Canada International. Then establish policies and procedures, clinical practice guidelines, and clinical pathways, so as to standardize things. Machine and equipment. Okay. The common problems here will be the lack of management system of these machines and equipment, okay. Lack of calibrations and preventive maintenance, okay, which lead to ECL waste of resources. Okay. Suggested strategies will be to put policies and procedures on these particular areas. Okay. And then money, and other resources. Okay. The main problem is there is always a limit in these resources. It's always a problem. So we just have to rely on the leadership and innovativeness of the leaders on how to get the money. The last category of problem here will be the trends in the hospital industry, healthcare, and health science category. Okay. So the most common problem is the rapid changes in the trends, which oftentimes are difficult to cope nowadays. Okay. So suggested strategies will be put up a knowledge management system that will constantly track all the information, all the data in the hospital, in the department, in the field of healthcare, and then continuing education. Then you also do benchmarking with other hospitals, local as well as abroad, and then make use of your innovativeness to respond to the trends, because you cannot really follow all the trends in medicine, in healthcare. So it's very expensive. Okay. So I like to end my lecture by flashing again the topics that I have covered. So at the end of the session, okay, the student is able to understand and how to run and manage a hospital effectively, efficiently, okay, by systematically using the system approach and perspective and system thinking, understanding the importance of alignment and integration, describe a department design, hospital department design and development framework, how to use and how to apply it and be familiar with it, and then discuss the common challenges encountered in the governance of departments together with their strategic solutions. As to the first objective, okay, I suggest to remember this. Okay, just remember this slide that illustrates the hospital and department systems as interrelated parts. Okay, I won't go into this anymore. Okay. And then for the importance of alignment and integration in managing a hospital and its departments, again, just remember these slides, okay, showing the pictorial differences between alignment and integration and steps towards a mature process. So the ultimate target is integration. Okay. Also remember the slide that illustrates the importance of alignment, collaboration, coordination, integration of all the departments and services to effectively and efficiently achieve performance excellence of a hospital. As to the third objective, just remember this particular framework. Okay, it is generic. It is applicable to all the departments in the hospital. It is comprehensive. It facilitates planning, learning, and governance of the department. You just have to put in the details in each box, okay, and compile them into an operations manual for the department. Common challenges, again, remember this starting table with 5 categories: man, systems and methods, machines, money, and trends. And just recall the common problems that I mentioned and my suggested strategies. You can add more as needed based on your settings and circumstances, particularly on the strategies. Okay, so I really hope you have acquired the prescribed learning outcomes that that has been prescribed for this particular lecture. Okay. So thank you for your kind attention. I'm now ready to answer questions if you may have.
Okay, are there any questions from the class for Dr. Joson?
Was I able to finish it in 45 minutes?
Actually, there's no, you have 2 hours for the lecture, Doc. Yeah, our time slot is up to 5 o'clock. So
Okay. Okay.
no need to hurry.
Yeah. Now I'll just use up
Yes,
5 minutes.
Dr. Cruz.
Hi, Doc. Good afternoon.
Sure.
With a good business development plan, I would just like to ask if there is a certain measure of time that the program is successful, sir, Doc. For example, time period of 5 years. If the goals are not achieved, would you say that it is a fail project?
Well, it depends on your set timetable. It all depends on what you set for the achievement. No? If you set it 3 years, if it's a big project, 3 years, or bigger project, 5 years, or sometimes even 10 years. Okay. So once you set the timetable and then you keep on evaluating it every year, every 2 years until you're satisfied with the result. If you're not satisfied with the result, it's either you stop it or you keep on doing it, but with continual improvement. There's really no set timeline, I mean, when to stop. No? Okay, it all depends.
Thank you, Doc.
You're welcome.
To add to that, I don't know if this class has taken HPAD 202. Have you taken it? Or is it something in the future? So HPAD 202 is practices of health administration. And there you will learn strategic planning when it comes to setting goals. And you will learn there that all these things, the measurable indicators, you will, it depends on your objectives and your goals. As a project or as a facility, as an organization, you're going to be the one to set it because it's your goals, your objectives, and therefore your strategy. You're the ones who's gonna design your evaluation plan, and you're following a framework there of continual development, just as Dr. Joson said. So there will come a time in that cycle where you will decide whether to improve on your strategy, to come up with a new strategy, so on and so forth. So we have a class for that, basically.
Okay.
So any other questions for Dr. Joson?
Patrick, may I interrupt you for a while? How many are
Yes.
international students here? Do we have international students?
Yes.
Okay.
Yes, sir.
How many? So
I am counting right now around 3. Is that
I
correct?
think we are 4 of us.
4. Sorry, 4.
okay.
Yeah.
From what
Dr.
country?
Nukman.
We are from Malaysia.
From
Malaysia.
bro.
All from Malaysia.
Malaysia, sir.
Okay, all from Malaysia.
Yes, sir.
Okay, so I'll take that into consideration when I give my lecture. Okay, I mentioned about the DOH requirements. This refers to the Philippine DOH, Department of Health. No? So we have level 1, level 2, level 3, up to level 3. No? So yours is you have Ministry of Health, not Department of Health, right? Ministry of Health for Malaysia. And then I don't know what categories of hospitals that you use in Malaysia.